Welcome to Arden Wood Presents on Zoom. And thank you, all 270 of you, for joining us today. I'm John Mitchell, and I serve as Executive Director and CEO of Arden Wood here in San Francisco. For generations, Arden Wood has been a refuge for Christian Scientists and their families. It's been fondly called a healing house where there's an expectation of quick and whole healing for anyone who comes for care. It's also a Christian Science Nurses Training Center. And it's a beautiful residence for Christian Scientists who are fully, happily engaged in ageless living. Most of all, Arden Wood is an idea that has evolved seamlessly over many generations and will continue to evolve to meet specific needs in ever-changing times. Arden Wood exists because you value a place where you are free to have a healing through the practice and application of Christian Science. Webinars like this one, and the 3 estate planning webinars last month, and the Evan McDonald Bible Talk last Saturday, which was amazing, are our gifts to you for all that you do throughout the year to support our healing mission. Thank you. And by the way, you can see a replay of Evan's Bible Talk until next Saturday, November 21st. Arden Wood is a 501c3 charitable nonprofit organization. This means it requires income from our patients, residents, and guests, as well as from donations to meet our operating expenses. You are invaluable to Arden Wood because your support enables us to offer uninterrupted services, something we've been doing for several generations. In return, we want to provide you with the best possible care and informative as well as inspiring programs. You surely bring out the best in us. I want to be sure you know about a very special Arden Wood tradition, our annual Christmas celebration. This year, for the first time, it's entirely online. Always held the first Sunday of December, this event marks the beginning of our Christmas season here. It's our favorite activity to share heart to heart each year. In fact, the theme of our program is Opening Hearts to the Christ. It will be a wonderful concert featuring both familiar and new voices and musicians. You can register right now on our website, ardenwood.org, and the link to register is on our homepage. Finally, the content shared today is informational and is not intended to be legal advice. And now, let me introduce today's presenters, Jim Maher and Lesleah Frisco. Jim is a certified senior advisor and a broker consultant specializing in Medicare. He's been helping individuals and companies navigate Medicare since 1989. He is a frequent guest speaker at law firms, CPAs, medical groups, school districts, Rotary clubs, and both large and small companies. Jim is also a certified long-term care insurance strategist. He specializes in helping human resource professionals with their Medicare questions regarding current employees and how Medicare integrates with retirees and COBRA. Jim lives in Lincoln, California, with his wife Teddy of 34 years and their very spoiled rat terriers. And Lesleah Frisco, Arden Wood's Director of Christian Science Nursing Services. Lesleah oversees everything related to Christian Science nursing here. And currently, she also heads up our Christian Science Nurses Training Program. Lesleah graduated from the Mother Church's Christian Science Nurses Training Program and has been a journal-listed Christian Science nurse since the late 1970s. One of Lesleah's responsibilities is to work with Medicare to ensure proper coverage for our patients who choose to use their Medicare benefit. In this regard, she is an unsung hero for her diligence and competence in wading through the intricacies of Medicare. She is joined in this effort by another Arden Wood colleague, Rogers Speer, who actually processes our Medicare and supplemental insurance paperwork. He will join Jim and Lesleah during the Q&A period. Arden Wood is one of 10 Medicare Part A Christian Science nursing facilities in the United States. Because our our audience rather, is nationwide, for this webinar, we will provide a list of the other 9 facilities in an email following this presentation. And before I turn the program over to Jim and Leslie, let me explain how you can ask questions. If you look at the bottom of your Zoom screen, you'll see an icon that says Q&A. Click on it, and a screen will appear where you can type in a question. Please submit, and it will arrive here. Once again, the Q&A function. We will collect them and save them for the end of the presentation when Jim, Leslie, and Rogers will answer as many questions as we have time for. We may also carry over some questions to next Thursday's webinar at the same time. Next week, we'll review what we've shared today and answer new questions. Please join me now in welcoming Jim and Leslie.
Hi, everyone. I'm Jim Maher. Hey, John, thank you for the nice introduction. Let's see, Leslie, are you going to start, I think, with the introduction?
I think I am, Jim.
Okay.
Good afternoon. As a longtime Christian Science nurse, I've had the privilege of witnessing many healings in both facilities and at home. Christian Science nursing does not include any medical care, but provides practical and skillful care for individuals that are fully relying on Christian Science for healing. Christian Science nurses are not just personal caregivers. We do much more than assisting with bathing and mobility, cleansing and bandaging, and making you comfortable. We are spiritual witnesses, beholding the perfect man, expecting quick and whole healing, and take a stand for the ever-present healing power of the Christ. We are part of the healing team, along with the patient and the Christian Science practitioner. Over the years, I've seen many Christian scientists who don't know if they have Medicare and don't know if it can be used at Arden Wood or other Christian Science facilities. So Jim and I are going to walk through how you can afford care and share many options with you. Jim will give you an overview of how Medicare works, and I will give you an overview of how it works for Christian Science nursing. Take it away, Jim.
There we go. Uh-oh. Did you get my screen?
Not yet.
Is that it?
Yes.
Hi, everybody. As you can tell, I'm not very IT savvy, but I can handle Medicare pretty good. Like John says, I've been doing it for, this is my 32nd year, actually. Let me see if I can get the screen. There we go. So I'm a certified senior advisor, long-term care insurance strategist. I've been helping families, individuals out for going on 32 years. And I absolutely love talking about Medicare. So I'm pretty good at that, but I'm really not good at Christian Scientist. So I'm going to rely on Leslie so I don't put my foot in my mouth and say anything incorrect. I can tell you what's going on. I think last year we talked about what's going on in the non-Christian Science world. If I'm saying that politically correct, I hope so. I never mean to offend anybody. Sometimes I say things I'm not sure that they come out, but I would never, ever intentionally offend anybody. So let's just kind of get on with rolling with Medicare and some of the updates. It's amazing how many people are on Medicare right now. So over 62 million people on Medicare, and over 10,000 people a day. They call it aging in, people turning 65. And if the election, just speaking about that, if we have a new president in the White House, they're looking at actually moving Medicare down to age 60. So you're going to see that number increase rapidly. So we're still awaiting results of that. But let's talk about what's in the news. And if I go too fast for you, I've been doing this a long time and I get very excited. My wife tells me I need to slow down. I get excited talking about Medicare. I happen to live up here in Lincoln, California, outside by a Sun City. So any parties we go to with people 65 plus, and I tell them what I do, I usually have 10 people surrounding me asking me about their plans or how Medicare works. But I just want to go over some of the basics today. And again, Leslie's going to hop in. Leslie, and you correct me or guide me, whatever you like to do. But I want to talk about the open enrollment period. It used to be very simple. It used to be called the open enrollment period. And that's always between October 15th through December 7th every year. And all the plan changes are effective January 1st. Well, guess what? They're not calling it the open enrollment period anymore. Some people are, but they're using the annual election period or the annual enrollment period. It all means the same thing, right? That's a time when if you have Medicare, certain Medicare plans, you can make changes. And some of these, I'm going to talk about some of these letters now, like Plan C and Part D and all that stuff, and we'll go through that in a few more slides. But essentially right now, every time you turn on the TV, right? TV or radio, everyone's telling you, you should change to their plan. I mean, you got Joe Namath telling you, hey, you should buy their plan. I don't know what it is, but people like Joe Namath, and they call me and they say, can we get Joe Namath's plan? Simply because they're endorsing. It doesn't matter if it's Humana or Aetna or AARP or Kaiser, whoever it is, they're all telling you they have the greatest plans with everything, and they're charging no premiums or very little premiums. So those are the plans they're talking about changing right now. And we'll go into more detail on how each of those work actually. So what is Medicare? It's our national health care plan, okay, for people 65 or older, or under certain disabilities under age 65. And what the government does, it's actually required for everybody over 65. And how they get your attention, if you don't sign up for it, they fine you, right? And you don't want that, because a lot of people pay fines because they don't understand it. I put up on the screen, that's the old Medicare card. So if you happen to see your mom and dad, aunt, uncle, neighbor, or something during the holidays, and they talk about Medicare, you want to make sure that they no longer have this card in their wallet, okay? They used to have their social security number on the front. So they changed it over a year ago. These are what the new cards look like, and they have a new 11-digit encrypted number on there. But I tell you, there's some people that just don't change, and anything new, they set aside and they keep the same old card. So if they happen to have one of those old cards, you want them to call 1-800-Medicare and help them get a new card. Everybody should have this card now, all throughout the United States. Medicare enrollment. So did you know you must sign up for Medicare at age 65 or you face a fine? And the fines can last forever. And they're not little fines. The only exception is that if you are a spouse, okay, work for a company that offers group health insurance that has more than 20 employees. That's the key. Under 20, you have to enroll. Over 20, you don't. The reason why, just the quick reasoning why, is because the group plan is always the primary payer if there's more than 20 employees, meaning they pay the claim first. And it gets confusing because they listen, everybody talks to their brother-in-law, their neighbor, their co-worker, and they're telling them, hey, you need to do this or you don't need to do that. But that's how it goes. If your spouse are covered under a group health plan with more than 20 employees, you don't have to do anything and you're not going to be fined. If you're self-employed, if you work for a small business owner, if you're retired, if you're on COBRA, you must sign up for Medicare or you're going to face a fine. So far, so good, Leslie?
Sounds good, Jim.
Okay, let's keep rolling. You let me know. So we're going to talk about enrollment periods and the 3 times you can enroll for Parts A and B of Medicare. That's the original Medicare that started back in 1965. All right, so there's 3 times. So first is the initial enrollment period. I'm going to go through these and then we'll go into an example. Hopefully that'll help clarify. The second is a special enrollment period. So if I'm still working, talk about that. And the third one, the general enrollment period, that's bad. And that acronym BAD stands for not good. That's bad because people that don't sign up for that usually face some kind of fine, right? So that's bad. That's not good. So when can you enroll, Leslie? That's a great question. Okay. The first one is your initial enrollment period. I set this up on one of my favorite days of the year. It's after April 16th because that's after tax day for me. So I really like that. I don't have to worry about that any longer. So the government says if my birthday, let's use this year, for example, April 16th of 1955, that means I would be turning 65 this year. Whether you like it or not, you're turning 65. I have some clients calling, they're in denial saying, I'm not turning 65. Well, most of you are, but the government pushes you forward. So if my birthday is April 16th, my effective date for Medicare in this example would be April 1st. The government says I can sign up during my initial enrollment period 3 months prior to the month I turn 65, which is my birthday month, and up to 3 months after. That's my 7-month initial enrollment period. So you've got plenty of time, because every time there's a national mailing house or database when you turn 64 and a half, that you get bombarded with advertisements from everybody doing Medicare, every insurance company, whether it's United American, Mutual of Omaha, it doesn't matter. Everybody wants your business. They don't really care about you. They just want you to purchase something. So you get bombarded from telemarketers and brokers and agents calling and say, deal with me, I have the best plan. So that's how you can tell when you're turning 65. You just look at your mailbox every day. The second enrollment period is super important for people that are still working. It's a special enrollment period. So if you're your spouse, I don't care if you're 65 and a half, you're 67, 74, I've done 87-year-olds coming off group plans, you're still protected. That means you're not going to pay a fine. So if you didn't sign up for Part A and B when you were first eligible because of the reasons here, you can sign up then and there's no penalty. Right? So you have to really protect yourself, because the government says it's up to you to know all this information. It's not up to them. You have to know what to do. So it's complicated. It's not easy. That's called job security for me, by the way. So that's a good thing. So you can sign up for Part A and B anytime you're still covered on a group health plan. So you don't have to worry about, do I have to wait for my company's open enrollment period or anything like that? The answer is no, you don't. I'm going to hold this up here. I don't know if this is a good prop, but this just came out. Can you all see the Medicare and You 2021 guide? This is kind of like my guide. And in there, it tells you. So when your HR or your boss tells you you can't do that, Medicare says, yes, you can. So you can come off your group plan whenever you decide it's time. All right. And they actually give you up to 8 months after, but most people never wait 8 months after you retire. You really want to give yourself a good 6 months leeway, and then maybe 4 months before that to get all the paperwork into the Social Security Administration. And again, no late enrollment penalties. You want to avoid those. And you'd be shocked how many people say, I didn't realize that, no one told me. I get that all the time. The third time is the third enrollment period is a general enrollment period, and that's really bad. That's when you fall asleep at the switch, you don't look at your mail, you don't do anything, you're not on a group plan, and you're going to get penalized probably from the government. As a matter of fact, the next slide is going to show you that they make you wait. So if my enrollment date, for example, was at April 16th this year and I didn't do it and I qualify for the general enrollment period, I can't just decide in November, December to sign up during this open enrollment period. That doesn't pertain to me. They actually make me wait till next year, and they won't allow me to sign up until between January 1 to March 31st. But here's the deal. It doesn't start till July. So I have to worry about a 12-month period. And the government says we can fine you 10% of the Part B. You don't need to you just have to remember there's a fine, but it's severe and it lasts forever. So you don't want that. So just make sure you take some kind of action, and you want to avoid those fines at all costs, because the penalties are forever, right? They don't go away. People ask me all the time, well, I don't mind paying for a month or two. I go, that's not how it works. You pay for it for a long time, for every month for the rest of your life. So you want to avoid that at all costs. So Leslie, anything here, or keep rolling? We're still good?
I am waiting for Part A Medicare to jump in.
Gotcha. Okay, we're coming up, so I'm going to scoot through this. So where do you sign up for coverage, right? So if you're going out looking for a Medicare office, well, you're out of luck, because there are no Medicare offices. The most confusing part about signing up is that you enroll through Social Security, right? That's the hardest part to understand. CMS, Centers for Medicare and Medicaid Services, is really the administrator for Medicare. So when you get mail, it says CMS or Social Security or Health and Human Services. That's not junk mail. You want to open that. That's normally important. So I'm deciding to sign up, right? I'm going to do it 3 months prior to when I turn 65. I'm doing everything right. So I'm going to sign up 3 ways. I have 3 options. The easiest way is to go to the government Social Security website, which is www.ssa.gov, which stands for Social Security Administration. That's the easiest way to do it. The 800 number now, I put that up there again because right now, most all the Social Security offices are closed due to the COVID. So you can't run down to your Social Security office. That would be the third way. So we don't know if they're going to open those next year, hopefully, because a lot of times people do need help. Here's the other unknown too. Did you know that people come in, they go, I don't know how to sign up for this Medicare thing here, but I got this envelope. Should I open this? And I go, well, yeah, it's from CMS. You probably should. Well, guess what? Lo and behold, there's their Medicare card. So I know one thing that tells me that they're either on railroad retirement, which is big up in my area, up outside of Sacramento or Roseville. That's big up here, or Social Security. That's the only way they automatically send you a Medicare card. And then once you get that card, you have options with A and B. So I'm coming up on Leslie's chiming in here. So now we're going to talk about the 4 parts of Medicare. There's A and B. It used to be very simple, right, Leslie? A is a hospital side, B is a medical side. Then they started adding this Part C thing, which nobody understands. Basically anything with initials, HMO, PPO, that's a Part C, Medicare Advantage, and we'll talk more about that. And then finally is the Part D prescription drug plan, where the government says, hey, it's voluntary, but if you don't get it, we're going to fine you. So we'll go into more details on that. So Leslie, do you want to go over a little Part A, or do you want me to click through it, or?
Why don't you click through and then I'll clarify how it applies to Christian Scientists.
Perfect. Okay. So Part A is the hospital side. That covers you when you do inpatient care in a hospital, not outpatient, but inpatient, skilled nursing facility. All right. Also, but here's the biggest, people have to understand this. There's no long-term care coverage. I get that all the time of people go inpatient into a hospital and they come out, and they have to understand how Medicare works with skilled care, not custodial or long-term care, unless they'll go more into that. It also covers hospice, which is end-of-life care, home health care, all Part A. And the quiz for today is, anybody know how much Part A costs? Well, the government tells you it's premium free. It doesn't cost a dime. Well, that could be true, because you pay into this, into Part A, while you're working through payroll tax. Every time you get a paycheck, you look at the bottom, you see that little deduction for 1.45%, and nobody pays attention to it because it's really small and it says Medicare taxes. Well, it adds up. So you pay that, and then the employer also matches. So they put all this money in a big trust fund, and they call that the Part A trust fund. So that's where it comes from. But it's drives me crazy when they say it's premium free, because it's really not. We've paid into it for a long time. If you ever really want to see how much free has cost you, simply look at your Social Security statement under hospital insurance. It will show your contributions into the Part A trust. So did you want to add anything, Leslie?
I would love to add. So how this applies to Christian Scientists. Part A covers room, board, and nursing care, and it may be used at Arden Wood or other Christian Science nursing facilities. We are certified by Medicare as a Part A provider, and they've classified us as a religious non-medical healthcare institution, or a RINCI. We are both the hospitalization and the SNF, so skilled nursing facility. And just important clarification here, it's not just that someone is over 65 to qualify. They must require skilled care. So there must be a need for care where someone else might be actually going to the hospital for it, or to a SNF. So that's really the main thing to know, Jim.
Good. Okay. Well, thank you. Next, we'll go on to Part B. So Part B is kind of the medical side, the doctor side of Medicare. It's the one that costs money. So A is premium free, and B, I'll show you how much that costs. But these are just some of the services covered under Part B. So you can kind of look at that. If you go to the doctor's office, urgent care, if a doctor sees you in a clinic, outpatient surgery, lab work, x-rays, MRIs, CAT scans. Remember I showed you my Medicare and You book? This is a great guide, which you all can get. You can get it for free, and it lists everything in there under Part B. It really is a great guide. It gives you everything you need to know about it. The one knock on Part B that people don't understand is that, guess what? There's a deductible. People think that this Medicare for all will be wonderful, and whether it is or not, but they have to understand, first off, it's not free, and there's lots of co-pays and deductibles, and they have to understand that. I get that all the time. Oh, Medicare will be great, I don't have to pay anything, and that's not how it works. So Part B this year has a cost, and we'll go over that. But if you just had Part B and no supplemental coverage or Medicare Advantage plan or anything like that, you're going to pay the first $203. That's the Part B deductible for 2021. So before it starts, you pay the first $203. And then they said, well, good news, the government's going to pay 80%, and you're going to pay 20% of whatever the Medicare approved rate is. Pretty simple. But here's the problem. Ta-da, there's no cap. So what's that mean? I had knee surgery a couple years ago, and they cut out the meniscus, or they used to call it cartilage. They call it meniscus. And it was outpatient surgery, 8 hours at one of the hospitals up here in Sacramento, outpatient surgery. And when I saw the bill, and I looked at every line item, I checked everything, $64,000 for 8-hour surgery. So if I was on Medicare and Part B covers outpatient surgery, right, I would be paying 20% of whatever the Medicare approved rate is, but there's no cap. That's why people usually turn to some type of insurance product so they don't have to worry about that. Because if I have a couple of those in a year, if I had my right knee done and maybe something else done as outpatient surgery, that gets very expensive. So that's why people have to understand Part A is great, Part B is really good, the doctor side, but again, it's 80-20, the government pays most of it, you pay a little of it, but there's no cap.
Jim, I'd like to jump in a little about how this might work for Christian Scientists, because as a general rule, we don't go to the hospital, but there are some times where Part B could cover if you ended up in an emergency room, if an ambulance were involved, having x-rays, having a bone set. But also, as Jim will probably tell you, if you're going to have a Medicare supplemental policy, they will require you to have Part B as well.
That's correct. Yeah, Leslie's absolutely right. You have to have A and B. And for those people who want to know how much, oops, I'm going the wrong way, how much Part B costs, ta-da, this just came out a couple days ago, actually, and I just put it in. These are the new 2021 Medicare Part B premiums. They went up a little, about 2.7%. This year, probably about 94% of you out there are paying the $148.50 a month. That's the Part B premium. If you're on receiving Social Security, they automatically take that out of your deposit every month. If not, the government doesn't bill monthly. They're going to send you a quarterly statement. That's what they do. So starting January 1, if you're going to not be on Social Security and have Part B, you're going to get a bill for, I think it's $455.50. That's going to be the new Part B quarterly premium. But guess what they do? They look at your income and they charge you an additional tax based on your modified adjusted gross income from 2 years ago. So for 2021, they're going to be looking at your 2019 tax returns. Not they don't trust you, but they're going to check with the IRS because you have Medicare, Social Security, and the IRS, and they're going to look at your tax records every year to see what bracket you fall in. You can see the more you make, the more they're going to charge you, and these are monthly costs. So if somebody's making, if I'm an individual, I'm making more than $500,000 2 years ago of modified adjusted gross income, they're going to charge me over $500 a month. If I file a joint tax return and I make over $750,000, they're going to charge me over $504 a month. The good news is that's not the majority of the population. Most people, I think it's 94% now, are going to just simply pay the $148.50. So these are the new numbers for next year. And I know we're going to send this out. I think we're going to put in a PDF so everybody can have access to it. So again, a great website too. If you need to go check, you can always go to medicare.gov. That's the government website, and check under Part B, and they've got all the premiums there also. Oh, here's the, I forgot to tell you, the IRMA. So people call me all the time. I got this letter, the IRMA thing. And the IRMA is just the additional tax. It's called an income-related monthly adjustment amount. And that's the amount they look at and see what you need to pay. And you do need to pay it. I have people say, well, I'm not going to pay. And I said, well, they're going to cut you off. So you need to pay the additional charge. And again, there's the fine, 10% for every 12-month period that you should have signed up and you didn't. So it gets your attention. So you want to make sure you don't face any fines. We ready to go through some of the Medicare insurance side?
Sure.
Okay. Okay. So after you sign up for Part A and B, like Leslie said, we're going to talk about the two types of insurance. Option one is the ones you're seeing on TV right now. Anything with an initial, they're called a Medicare Advantage or a Part C plan of Medicare. Part C just simply means that, listen, it's everything that A and B is, and it even includes Part D. How confusing is that? C is A and B plus D, but it's all in one wrapper. So it's the ones you see on TV all the time. Anything with an initial, HMO, PPO, point of service, it doesn't matter. They're all Medicare Advantage plans. And they sell them, they do a great job, right? Leslie, they make sure everybody should go buy one. They make them sound like the greatest thing since sliced bread, really.
Very popular.
Very popular. So now I'm going to tell you the pluses, and I'm going to tell you what they don't tell you on TV. Again, anything that has an initial HMO, PPO is a Medicare Advantage plan. You've got to have both parts A and B of Medicare to get this plan. So how, tell me how, you can, when you're 60 to 64, how expensive health insurance is out there. Yeah, I see it anywhere from $800 to $1,200 to $1,400 a month. So how can you turn 65 and they say, hey, welcome to Medicare. Leslie, you can get this Medicare Advantage plan and pay zero. How the heck do they do that? Well, behind the scenes, the government is saying, look at insurance company, it doesn't matter, ABC, we're going to give you a monthly amount or an annual amount. Usually it's anywhere from $1,000 to $12,000 a year. That's pretty standard in Northern California here. We're going to give that to the insurance company, in this case, insurance company ABC, and they're going to offer you a Medicare Advantage plan, where they have Joe Namath advertise on TV and tell you how great it is, and you don't pay any premiums, and you get all these, it's easy and low cost, and we give you your prescription drug coverage, and guess what? You can change your plans every year. Here's what they don't tell you, okay? They're restrictive. So if we back up to parts A and B of Medicare, right? Leslie, I don't think I told everybody, with original Medicare, you can go anywhere you want in the country or the US or its territories, anywhere they accept Medicare, parts A and B. So it's total freedom to go wherever you want. When you get a Part C plan, they tell you all the good stuff on there, low cost, low co-pays, some dental vision. It may not be very good, but that's okay. They want to hook you into their plan. They just simply forget to tell you that it's a narrow network. You can only go to certain providers or hospitals. They kind of forget to tell you that, right? Or that if you're on there for more than a few years, and if you want to disenroll back to Medicare, that you may no longer qualify for a Medicare supplement. Because if I tell you that on an advertisement, even if it's Joe Namath, you're probably not going to buy the plan. So they put that in that like size 4 font down on the very bottom and tell you, make sure you check all the disclosures, that 64-page disclosure before you sign up. So it is the big R, it is restrictive. I think of it like a golf course, whether you're a golfer or not. I'm not a big golfer, but I do understand a golf course. Original Medicare is like a golf course where you can go anywhere on that golf course you want. You go on the first hole, you can go to Stanford, in my area, UC Davis, Mayo Clinic, MD Anderson Cancer Center, all the major facilities across the United States. Most all of them, 94% of physicians accept Medicare. Most all facilities and hospitals accept it. So you can go anywhere you want on that golf course. And then you say, well, listen, I really like that commercial. I'm going to sign up for that company ABC where I pay zero. And they go, well, Jim, that's great. You're going to pay zero, but here's how it works. You're going to receive all your care on the first hole of that golf course. I go, well, I guess that's not so bad, but if I want to see a specialist, I can still go to the 18th hole, right, to Stanford or UCSF and see a specialist. And they go, I'm sorry, Jim, that's not how it works. You see the oncologist putting on the first hole there? That's who you're going to see, or your neurologist or your orthopedic surgeon. I go, well, that's not really what I want. And they go, well, that's how the plan works. So again, some of these plans work great for people. You just have to make sure you understand everything about them before you sign up, or your neighbor tells you that you're way overpaying for what you have and that you should go to this plan because that's what they've been doing. So everyone is different. You have to look at all the companies out there and make sure that you do what's best for you, not for the insurance company, not for the agent, or not because your neighbor or brother-in-law told you to do it. So
Jim, it also requires you to have a primary care physician, which is not something that most Christian Scientists have. So it is restrictive in that way. And as far as for Christian Scientists, there are fewer options in that it does require us getting approval for authorization for coverage within our facilities. And the challenge is, even though the Medicare law says that all Medicare Advantage plans must cover everything that original Medicare covers, they don't seem to understand that Rinkies are part of that. And so it has been very challenging at times, at most times, to be able to receive reimbursement. We've had some wonderful successes. We're very grateful for the support of some wonderful Christian Science attorneys that have worked with us. It often takes quite a while to get that reimbursement. And it's just something to be aware of. It's not a given at this point, but a lot of educating is going on as well. So hopeful in the future.
I totally agree with you, Leslie. You really want to educate yourself, because I see clients do this all the time. They get talked into something that sounds so good and so low cost, and then they don't have the freedom. Like with A and B, parts A and B of Medicare, that's total freedom. You go wherever you want. So I'm a big fan of total freedom. I think as we age, we'd rather have more choices, not fewer choices, myself personally. So
I would just add, if you know that you are going to want Christian Science care, it is probably easier to just stay in original Medicare and get a Medicare Advantage than venturing into the I'll say that again. It is better to stay in original Medicare with the Medicare Supplemental, which Jim will talk about next.
yeah, we've got a few slides, right?
Yeah.
Okay, so now remember I told you about the Medicare open enrollment period and how they're changing the names, and now they're calling the October 15th through the December 7th. They're calling that the annual election period or the annual enrollment period. Well, they said, I know this won't be confusing for people at all. Hey, we're going to start a new Medicare open enrollment period starting January 1st to March 31st. So if you took out one of those Medicare Advantage plans that they advertise on TV, and you said, boy, I went to company ABC and I was with company XYZ, they're going, listen, you can go back and make a change. You can do a do-over, a one-time do-over. So I don't know how people are ever going to understand this. I know a lot of brokers and agents are confused by it. So essentially you get a do-over if you went from, for example, Kaiser to a Humana plan or something. You can go from Humana now to another AARP plan or whatever it is. It doesn't matter. So that's what they're going to start calling the new Medicare Advantage open enrollment period. Okay. They just don't make it easy. I wish they'd put me in charge, because I could fix this whole thing and make it, like October 1 to December 31st. That's it. You get one shot, you do it. But they keep having these open enrollment periods where they think they're helping people. And I really think they're doing them a disservice because they don't understand it. Now, I'm going to talk about what Leslie said. This is my favorite option for Medicare. From doing this for a long period of time, I see people all the time. And I go, Jim, I'm really healthy. Fortunately, I know most Christian Science people I talk to are incredibly healthy. You're very blessed. Some CS, right? Non-CS folks are maybe not as healthy as you. Sometimes I see that a lot of obesity out there, and people want to go to different venues for care, whether it's for specialists, oncologists, whatever it is. But I like Leslie. I agree. I love having Part A and B of Medicare, where you have the freedom to go to any place you want in the United States or its territories, wherever you want. There's no list. People get used to a list, and I say, listen, if you're down seeing your family, I don't care if it's in Austin, Texas, Topeka, Kansas, Des Moines, Iowa, I don't care where it is. You simply pick up the phone and say, I've got original Medicare. It's pretty easy to get an appointment. You don't have to worry if you're, am I on urgent care or whatever it is. You don't need to worry about that. So I'm a huge fan of original Medicare. So now we're going to talk about what Leslie was talking about, the Medicare supplements and a Part D prescription drug plan. Okay. Because remember, with original Medicare, that 20%, that's a killer. I mean, you don't want to have a 20% with no cap. So we're going to talk about why people go to insurance companies and say, give me some type of protection. When they talk about Medicare supplement plans or Medigap plans, It's the exact same thing. It's never easy. No one can just say, we're only going to call it Medicare Supplement. No, it's a Medigap. My neighbor says it's Medigap. You say it's Medicare Supplement. It's the same thing. You have to have Parts A and B of Medicare, and you're going to pay a premium for a policy to an insurance company. But here's the plus about these Medicare supplements. They're guaranteed renewable. In other words, they cannot be canceled. They can't single you out because of claims. A lot of people worry about, well, gee, if I use too much service, maybe they'll cancel me. They cannot do it. It's a contract with an insurance company. I don't care how much service you use. They cannot single you out and cancel your plan. It's terrific. I'm sure I'm going to talk mainly about California. I'm licensed in several other states, but this I'm doing this because the California, I think we have the majority here in California. And these are two of the most popular plans that are out here. And this is where you're going to raise your hand after and go, I thought Plan F is no longer available. It's only Plan G. These are the two most popular plans. If you look at Medicare Supplement Plan F that you're going to purchase through an insurance company, I don't care if it's company ABC or XYZ, Plan F is the same with every single insurance company out there. It all works the same. The only thing that's different are the premiums and the claims payability of the insurance company. I just was reading an article this morning and I saw the difference in actually Des Moines, Iowa, of all places, that some of these plans can vary from $95 to $315 a month for the same plans. In San Francisco, for the exact same plan, it was $115 to $285. I would kind of think the opposite would be more expensive, but it isn't. So Plan F, like Frank, was one of my favorite plans I've sold for years. The reason why, whatever Medicare approves, Plan F pays 100%. It's really easy. Medicare approves that you don't have a copay, a co-insurance, or a deductible. It's really easy. The problem is, Leslie, this plan just got, I guess, too good. So the previous administration decided that they were going to do away with Plan F. So starting, if you turn 65 after January 1 of 2020, this year, you can no longer purchase Plan F, like Frank. You can't do it. But if you're 65 prior to January 1, you can still get it. So for example, if you're 67, 68, you're still working, regardless of what your brother-in-law tells you, doesn't matter, he's wrong, you can still purchase Plan F out there. It's great. If you like simple and easy, that's how Plan F is. I highlighted Plan G because that's the next most popular plan, G like George. It's identical to Plan F for inpatient hospital. There's only one difference. If you look, you can see the little dash next to Part B medical deductible. If you go across it there, that means you're responsible for the Part B deductible that the government sets every year. This year, it's $198, and they just announced next year it's only going up to $203. And I think it's because of the COVID that they backed it down. It was supposed to go up a little higher, but it's $203. So if you had Plan G and you go inpatient hospital, let's talk about inpatient, you're going to be covered at 100%, right? If you do outpatient surgery, doctor, lab work, anything like that, you're going to pay next year the first $203. That's your deductible. Once you pierce that deductible, then you're covered at 100% for the remainder of the calendar year. Pretty simple. It's a great plan. You just want to make sure you've got a really good company out there. And I'm going to talk about companies in a minute here. I usually don't get too specific, but I've got something I want to share with you today. But that's the top two plans. Plan F is easy. Leslie, anything you want to add on the supplemental side?
Sure. I just want to say that this is very easy for us to process here because we can automatically file the Medicare claim and then the Medicare supplemental. It's very easy for that to get approved here. And it will cover your deductibles and your copays. So it actually, often people think, oh, I can't afford to come to Arden Wood or a Christian Science facility. If you have Part A Medicare and a supplemental, it actually might cost you nothing to be here. So that's just good to know. If you have an older policy that has a Christian Science rider or an SCS policy, hang on to it because they're really not issuing those much anymore. So since the Affordable Care Act, it's been difficult, but it will still be honored. And it's also difficult to get coverage in a Christian Science facility unless you are 65 or over. We've just had some challenges with that with insurance.
Very good. We'll keep moving on. So I'm going to talk about California because California says, listen, we're going to take care of you, because a lot of these companies, when they sell a supplemental plan, they start off very low. I like to call them a teaser rate. It's like too good to be true, right? How come you're so much less than everybody else? Well, trust me, they're going to make up for it. I'm not going to name any specific companies, but they both have colors in their name. So a lot of those plans start very low, and as you age, they get very expensive. I helped a elderly, I shouldn't say elderly, she's 84. She's probably in better shape than I am. She had actually, I'll just say she had a Blue Shield plan that she was paying $360 or something for a Plan F. But by simply letting her know to take advantage of her 30-day birthday rule, I was able to move her to another plan, okay, for $269. And it's the same exact plan, the same exact benefits. The claims paying ability of this other insurance company was probably better. But I found out that most people, I have to be careful because they go, listen, Jim, that's too good to be true. You can't do that. So normally I like to get an adult child, or in this case, her niece came over, and we explained how it worked, how it was the same plan. The only thing it does is save her aunt money. That's all it does. So you need to understand that every year within 30 days of your birthday in California, it's usually about 60 days, actually, you can change. So if you have a Plan F with company ABC and you want to move to company XYZ, you can do that. And you have to realize they all tick up a little bit every year. Some tick up a lot more than others. So you really have to be a good consumer. You can't just put that policy in your drawer, shut the drawer, and not worry about it. You really need to look at it once in a while. The nice thing too on these changes, there's no waiting periods or pre-existing conditions by both federal and state law. So you're protected no matter what, okay? I'm gonna do something here that I usually don't talk about, but I'm gonna talk about it because AARP United Healthcare, whether you like them or not, okay, they sent me notice that they're going to allow people to change with any insurance company with them. And one thing about whether you love or hate AARP United Healthcare, their plans, if you look rate-wise, they're excellent. They're over a 10-year period, they're one of the best. So I was debating whether to put this out here, but I thought, you know, it may help some of you if I actually give you the name of it. So in California, through next March, you can change your plan. So if you've got a plan you've had for more than 3 or 4 years, you may want to check with your company, broker, agent, whoever it is, and say, listen, can I get a different plan and do something that's actually going to be the same but save me some money? Remember, guaranteed acceptance, no underwriting. You don't need to take any physicals or anything like that at all. And Plan F is the same with company. It doesn't matter who, or Plan G is the same company. They're all the same. So don't let anybody scare you and say you have to keep that plan forever, because you can change and there's no waiting periods or pre-existing conditions. So.
Jim, I know we're talking about the Medicare Supplemental. Some of these companies, such as United Healthcare, they also are Medicare Advantage, but they also have a Medicare Supplemental. So really do your homework and be sure you're signing up for the one you intend to sign up for.
That's an excellent point, right? Anything that says initial after PPO, HMO, anything like that is a Medicare Advantage. You want something that says Medicare Supplement on the front of the brochure or the booklet. So. Last part, we're going to talk about Part D. That's a prescription drug plan. Government says it's a voluntary program, right? But if you don't sign up for it, they're going to fine you. So to get a prescription drug plan, you've got to have Part A and B. And the government doesn't set these programs. They allow insurance companies that meet certain guidelines to sell them. And again, on TV, you see them all from Humana and SilverScript and AARP and everybody WellCare. They all have the best Part D plans, but they're all different. So you really have to be a good consumer right now, because now is a good time to change. Every year, you can change during the open enrollment period. And it's super important because I've seen plans, there was a plan out there last year that was $14.10. And they said, well, you know what? We're changing this year and it's going to double. It's going to go up to $30. But if you go to our new company that we created, it's only going to be $15.10. So you really have to look every year and look at your prescription drugs and say, does it make sense for me to stay on this plan? Or am I going to go to a plan like, for example, SilverScript CVS has a new plan out there. It's $7.20. So if you're not taking any prescriptions, you want to look at a very low cost plan like that. It satisfies the government's requirements, so there'll be no fine, but you've got a great plan and you don't have to worry about, and if things change, you can change every year. So as we age and if you have more prescriptions, you can change the following year. You're never stuck in a plan forever. Oh, guess what, too? The government thought, remember we talked about the fines, the extra premium? Well, the government said, well, we charge you extra for Part B. Well, what about Part D? They say, that's a good idea. So this is what they charge you now for an income-related monthly adjustment amount, an IRMA, an extra tax for your Part D. So I actually talked to a client this morning, and they're a business owner in the Bay Area in San Jose. And this is unbelievable, but they called me and said, Jim, we got a notice from the government that we have to pay an additional, it was $77 last year. She goes, a month. But the plan they signed up for is $7.20 a month. So the income adjustment was 10 times more than the plan itself. So just so you know that they're looking to tax people that have a higher income. So you have to be careful. And just a side note, these income-related monthly adjustments amounts, or IRMAs as they're called, can change. So if I'm this business owner and I'm making this large sum of money and I retire, well, I'm not going to have that large sum of money coming in. So you can simply request the Social Security reviews your income. It's a lifestyle change, and hopefully they reduce it for you. So you've always got that option, and you always want to try. What else are we going to talk about? We talked about the income-related monthly adjustment amount, original Medicare, things that are not covered that everyone thinks are covered, unless you jump in here on the long-term care. So everybody comes in my office, they all want to know, hey, what about vision and dental? Number one question, what about vision and dental? Medicare does not cover dental or vision. But that's the problem. You see those ads on TV right now for the Medicare Advantage plan saying, well, you're going to get some dental and vision. You better look at the dental and vision, because sometimes it's not what you were used to have. You know, you get what you pay for. And if you're paying zero premium, you have to look at what you're getting, you're receiving for that. Hearing aids, that's getting popular right now. A lot of plans, some of the Medicare Advantage plans do offer hearing aids, but Medicare does not cover dental, vision, hearing, private duty nursing, and no long-term care. Okay, Leslie, I can't speak. Gonna have to help me here with the Christian Science. I'm not sure how it works, but I can speak to non-Christian Science in a minute here.
There's a few things it does not cover for Christian Scientists. It does not cover home nursing for Christian Scientists. And it also does not cover Christian Science practitioners. So those are just two things that might impact us a little.
Okay. So again, I always tell people, and if I'm not, you correct me if I mess up here, Leslie, but healthcare is really focused on getting you healthy, right? Getting you back on your feet and getting going. Long-term care, the people I see that are receiving long-term care outside of the Christian Science facilities, it's about caring, right? A lot of times it's not about curing when they're at that point. So people going into skilled nursing, the average Medicare says, listen, we normally cover the first 20 days. And for example, the supplement would kick in after that. But you have to, I'm going to tell you the hoops you have to jump through to make sure that happens. But just so people know out there, skilled care is really covered for about 28 days. I see people that go, well, Medicare is going to cover me for 100 days. It says it will. You have to look, because that's for skilled care, not custodial care, not help with eating, bathing, dressing, things like that. Medicare says we don't do that. Once you're eligible for that, Medicare is no longer going to cover you. Again, custodial care is not covered by Medicare. I'm going to jump in here, Leslie, because this is really important for people non-Christian Science. It's super important you understand admittance versus observation right now, because I see this happen all the time to people that are going into the hospital. It happened to my cousin and my aunt down in San Jose. Part A. Part A is when you get admitted to the hospital, right? You go in, every time you go into the hospital, you think, well, if I'm going to be overnight, I'm admitted to the hospital. That's not exactly true. What happens is, I'm just going to tell you what happened to my aunt down in San Jose. She was in her 90s and she fell, and they took her to O'Connor Hospital in San Jose. And my cousin Michael, who's a CPA, really smart guy, and he called and said, hey, they're taking mom over to O'Connor again, and she's in an ambulance and they're taking her over there. And I said, well, that's, you know, I'm glad she's getting good care. That's a good hospital. So I said, well, you need to check and ask them whether she's going to be admitted or under observation. He goes, well, I don't even know what you're saying or talking about. I said, just do me a favor and ask, please. Just go ahead. So later that night, about 11 o'clock at night, my cell phone rings. And you don't want your phone, you don't want people calling you after 11 or 12, right? That's normally not good news. So he calls me from the hospital and he goes, you're right. They told me mom is under observation. Well, what does that mean? Well, this is what it means. She's under Part B. She's not under Part A of Medicare. Why is that so important? Well, this didn't happen to my aunt, but it's happened to other clients. Guess what? If somebody's in that hospital for 3 or 4 days, right? Medicare says you need to be in there 3 days, discharged on the 4th day, 3 midnights and discharged to be eligible for the skilled nursing benefit for non-Christian Science, right? This is non-Christian Science. And Medicare will cover you for the first 20 days as long as it's still skilled care. Well, hospitals started getting fined across the United States because if somebody I don't want to get too technical. If they come back into the hospital too soon after they've been discharged, it's bad and the hospitals get fined. So they said, hey, I know, what if we put people under Part B? Because if we put them under Part B, under observation, guess what? We can't get fined, right? They don't know the difference. My cousin didn't know the difference. He says mom is in the same room at O'Connor Hospital as she was before, same nurses, same everything there. And he goes, I don't understand the difference. And I said, this is what happens. This is how people find out. If my aunt was in there even 3 days, discharged on the 4th day, and she goes into a skilled nursing facility and tell my cousin, listen, I need a check for $12,000. And he's gonna say, well, wait a sec. I think this Medicare thing covered her. And they go, well, listen, we checked with the hospital. She was never admitted. She was put under Part B of Medicare. Part B does not cover skilled nursing care, only Part A does. So you need to ask. Actually, they passed a law now that requires they have to have you sign off on it. But let me tell you this, like my cousin said, I said, Michael, if they tell you, hey, your mom's under observation and that's a good thing, sign here, right? You don't know. I want to make sure my mom is being observed, so I guess that's a good thing. Nobody really knows what that means when you sign all those forms.
Jim, I'm looking at the clock here, and I think we're getting really close to question and answer time.
All right.
So,
I guess I told too many stories. Sorry.
There's more that we can cover, so I think we may just say stay tuned for other details.
Okay.
Next week's presentation, and maybe we'll move to question and answers now.
Very good.
Do we have some questions ready?
Do you want me to cut off the screen?
I think so.
Okay. Stop share.
Great.
Yes.
Well, thank you, Leslie and Jim, for guiding us through the ins and outs of Medicare for Christian Scientists today. There's a lot here, as we have well established. We also want you to know that Arden Wood can serve as an ongoing resource in understanding Medicare. So please don't hesitate to call with any questions at any time. We're happy to help. Before we go to questions, let's first take a poll, a quick poll. A question will pop up on your screen. Simply click your response and Zoom will take care of the rest. Then we'll turn to your questions. So let's do a quick poll and we'll give you the results shortly. I've got some nice questions here. I think we're going to go until about 5:15 if everybody's okay with that. So about 15 more minutes. We'll also cover some of these questions next week. But let's just please complete the poll and let's take a moment. This is great. Your stories are very helpful, Jim. We need to know the ins and outs of this. My goodness.
Thank God I have a large family.
Buyer beware.
Yes.
Benefits, but buyer beware. Leslie, while they're completing the poll here, I'm going to jump to one question before we get to the actual Q&As, because you use a term that I think a lot of people don't know. Can you please define what a RINKI is and how that relates to Christian Science?
A RINKI is how Medicare has determined the Christian Science nursing facilities all fit in that category. It's a religious, non-medical healthcare institution. It means that your Part A Medicare benefits can be used for Christian Science nursing care in a certified RINKI, such as Arden Wood and the 9 others. So
Right.
It does not require, so some of these rules and things you're hearing about requirements for Medicare, whether it's observation or limited days and SNFs, those don't apply in the same way in a Christian Science facility. We make the determination when someone no longer needs skilled care.
Great, thank you for that. And as I mentioned earlier, you'll see the list of the 10 facilities that are considered RINKIs, and that legislation, Christian Science was put into the Medicare legislation in 1965, so it goes right back to the beginning. Eddie, can we quick see the poll, and then we'll go to the questions. Do you know if you're registered for Medicare? 96%, I'm sorry, the writing's a little small here. 96 participants said, or 87% said yes, 13% said no. Do you have basic or Medicare Advantage? 69% had Medicare, 7% Medicare Advantage, and 24% had neither. Do you have supplemental insurance? 19% said yes. So very interesting.
That is interesting.
81% did not have supplemental insurance. And finally, do you have an advanced healthcare directive or AHCD? 44% said yes, 56% said no. That is so important, that last question. Leslie, let's jump into that, then we'll go into questions, please, about an AHCD.
We'll need to come back next week where we can go in for detail, but it's such a protection to have an advanced healthcare directive in place. It's just essential at any age. It just gives you an opportunity to determine your choice of care. So if you were ever admitted to a medical setting, whether you wanted to be there or not, it clearly shows, or if you're ever able to not speak for yourself, you've then designated an agent that will represent you and speak for you. It's without that, it's not enough just to have a spouse there saying, this is what I know she'd want. You have to have it in writing. So just can't urge enough.
Can't emphasize it enough. We've seen this time and time again. There is an AHCD form on the Arden Wood website. It is California focused, but they're very similar, but please check it out on our website. Let's go to questions, and we will be able to go about 10 minutes or so, and then we'll have some for next year.
John, is this like
next
Stump
week.
the Stars with Medicare? Is that what we're doing? No, just...
Is Rogers joining us?
We've got Rogers on as well. Hello, welcome,
Okay,
Rogers.
Yes,
Be
thank
ready.
you.
Okay.
Rogers' video off.
So
My video's off.
Oh, there
nope,
you go.
we can see you.
Okay.
I can see you. So can you sign up for Part A when you turn 65 and then wait to sign up for Part B once you come off the employer plan?
Yes. Ta-da, one for Jim. Yes, the answer is yes. And that's what we're talking about. That was that special enrollment period. So if you do sign up for Part A and you're still working and you come off, you can sign up for Part B and there's no penalty. So once you leave a group plan, you actually have 8 months to do that, but most people don't wait 8 months.
Great, thank you. Please tell people about Medicare fraud calls and letters and how to protect themselves.
Oh, you want me to jump on that too, or is that?
I think you're the best qualified here, Jim.
Okay, well, I see this all the time, especially with the COVID out there and things that were happening with the Social Security, where it's a great point. People are calling, acting if they actually have cell phones now that'll populate, right? That say when it rings, it's showing it's from Social Security or Medicare. So you have to be very careful. They're not going to call you and ask you for information or money, right? They're not going to ask you about your bank account. So you have to be very, very cautious. If somebody calls you, you just say, I can't talk to you, and you call 1-800-Medicare and ask them if anybody is supposed to call you. No, Medicare does not call, Social Security does not call you. So you never want to get out any banking information, routing numbers, or anything like that at all with Medicare.
Very helpful. Thank you. What is a cap? You mentioned a cap.
A cap
I guess
is a
it's for Jim.
limit.
Yeah.
Right. So like we said on the 20%, if I just have Part B of Medicare and I'm paying my 20%, there's no stop loss. There's no out-of-pocket maximum. Like if you're on under 65 and on a group health plan or any plan, they all have what's called an out-of-pocket maximum. Right, it varies right now from $6,000 to $7,000 to $8,000. With original Medicare Part B, there is no cap. You can pay that 20%. You keep paying it. There is no $6,000 or $7,000 limit, so it's uncapped.
Perfect. Leslie, this is a question for you. Part A Medicare, how long does Part A pay for at Arden Wood?
Okay, it is considered a short-term benefit, not long-term care. So there is full coverage for up to 60 days, and there's partial coverage for another 30 days. So that's kind of a 90-day window. And then after that, it goes into Medicare exhaust. Of course, it's not a given that you have 60 or 90 days when you're admitted. We're all expecting quick and whole healing. So it might be that someone's here for 10 days and they improve so much that we need to take them off. They're no longer needing skilled care. So that's a good thing. So that's why if it does go beyond that period of time, if there's an ongoing skilled care need, having a Medicare supplemental can be really helpful. It would cover the initial deductible, which right now is roughly $1,400. And then the daily deductible for the copay, Jim, help me out here. It's like
352.
352. Thank you, Rogers, for this year. And then that's only till you get to the end of those 30 days. And then it's Medicare does not cover beyond that. If you do not use Medicare, after you used it for a while, if you do not use it for a 60-day period, it resets and you're in a new benefit period.
That's right.
It's not that you can only use it once a year.
Perfect. Thank you.
Mm-hmm.
Question. I have Medicare Part A and B and also Medicare Advantage to try to add just dental and vision, which the plan says only costs me $47 a month. What am I missing here as to canceling the Advantage plan and finding a supplemental that is more beneficial?
Well, again, it's the freedom of choice, right? Medicare Advantage, it's a smaller network. It's that example, you're receiving all your care on the first hole on the golf course. With original Medicare, you can go anywhere in the United States or its territory, so there's no restrictions. So that's the big disadvantage of a Medicare Advantage plan, I think personally. It's restricted to a certain network, physicians, and hospitals. Whereas original Medicare, you can go anywhere, any place throughout the United States that takes Medicare. You can also purchase dental and vision outside. You don't have to go through the Medicare Advantage plan too. You can buy individual plans. So you don't need to stay on a Medicare Advantage plan simply because of that.
Great. Can you elaborate on Plan B premiums? Yes, Jim.
Yeah, they went up. They're not going to go down anytime soon. So last year, the Part B premium was, what was it, $144.60, and it went up to $148.50 starting in January. So basically how they do that, just so you understand, is that a group of trustees get together and they look at the cost, what they think the gross cost is going to be. And they say, listen, the government's going to pay 75% of that cost, and most people are going to pay 25%. So this year, the 25% is $144.60. The government pays the other 75%. That comes out of the general fund every year for Medicare. And it's going up. It's not going to go down. It's going up. So,
Leslie, this is a question for you. And Rogers, can someone who is disabled, enrolled in Medicare and Medi-Cal, but not yet 65, receive care at Arden Wood?
Yes. The Medicare based on disability, which means you may be under 65, it is still Medicare Part A, could still be used at Arden Wood. The one thing is that we are not a Medi-Cal provider, so that would not apply.
Great. Now,
Medicaid.
excuse me. What was that?
Medi-Cal is what it is here. In other states, it's Medicaid. We are
Correct.
only a Medicare Part A provider.
Right, we are not Medi-Cal. Now I'm going to loop, there's a few questions here on Medicare Part D. I've been on Medicare for 6 years. Can I still enroll in a supplement? Also, I've never signed up for D since I don't take drugs.
Yes and yes. So you can apply for a supplement anytime. Well, the plus is when you start your Part B of Medicare, they give you a 6-month open enrollment period with any insurance company to get your Medicare supplement. It doesn't matter. There's no waiting periods or pre-existing conditions. You can have cancer, stroke, heart attack. You get the policy. There's no issues. After that, you have to answer the health questions to make sure that you qualify. So some of them are easier than others. You just have to look at the insurance companies, but yes, you can. Part D, you can sign up right now during the open enrollment period between October 15th through the December 7th. But the government's going to like you because they're going to send you a letter after and saying, listen, you haven't signed up for, what'd you say, 6 years? That's 72 months times 33 cents a month that they're going to charge you each month for the rest of your life because you did not sign up for a Part D plan. So they will fine you. Sooner or later, they will catch you, and they do fine you.
Great. That's what these questions, the next one, is there, I guess you just answered it, is there a monetary penalty for delaying signing up for Medicare Part D prescription drug coverage? There you go.
Jim,
you just
can
explained
I
the penalty.
jump in here and ask a question to clarify that? As
Sure.
Christian Scientists, we do not use drugs at all. So you mentioned this fine, but does that fine only come into being if you decide down the road that you do want to use the D? If you never use the drugs and you don't actually need to sign up for Part D.
That's absolutely correct, Rogers. Absolutely. That's absolutely right.
Well, there's a few questions here, and I see we've got about 3 minutes to go. I'm just choosing one. Leslie, and Rogers, which insurance companies cover Christian Science nursing and long-term nursing care for a person who does not have Medicare or qualify for Medicare and is over 65?
Rogers.
Yeah, that's, as Leslie had mentioned earlier, SDS, was it Serving Christian Science?
SCS.
If you have the policy, hang on to it because that typically works in that regards, but they're not writing new policies, my understanding. The SHIP, I think it's Senior Health Insurance Program out of Pennsylvania. They've been helpful here as well, but again, I understand that they're having some issues with new policies. I'm not sure of any companies that are writing new policies after was it ACA came online.
I can speak to that just for a minute too. In the non-Christian Science world, they've started, there's new types of policies out there for long-term care, for home care. Some of them are asset-based, meaning if you put money in, you'll double or triple your benefit. If you don't use it, you get all your money back. So there are some Christian organizations out there writing traditional policies. But Rogers, you made a good point. The long-term care industry went upside down. So a lot of companies quit writing business, especially in California. But there are new policies out there, and there's new innovative ways to cover long-term care stays.
It's just harder now to get a Christian Science writer on them.
Oh, yeah, I apologize. I don't understand the Christian Science writer, so.
It's just, you may have it, but they may not actually pay here.
Yeah.
There are a number of questions. Go ahead, Roger, were you going to say something?
Oh, no, I was just going to agree with Leslie on that. Yeah, they would, they have language in there that specifically states it has to have a physician authorize this or that or something like that, right. Which excludes us.
Great. There are many more questions. I'm going to take the last question now, and then we will organize these for next week. And once again, it's the same time next week, 4 o'clock to 5 o'clock Pacific. Here's the last question before we conclude. Wife and I are over 70. Do we need a G, a plan G?
A supplemental plan G. Well, if you just have original Medicare, right, Parts A and B, right now, you know that if you go in the hospital, right, Rogers, we talked about the Part A deductible. Next year, it's $1,484 for that. And the Part B is 20%. So that would be up to them. It's a personal decision to pay money to an insurance company to have some kind of cap, right? Plan G says you're going to be responsible for the first $203 for outpatient services, doctor's visits. After that, it's covered at 100%. So if you have the means, you should absolutely look into it because it protects you. There's a ceiling on what you can spend.
Perfect. Well, we'll conclude at that. There's much more to cover next week, and there's many more questions. Thank you one and all again for joining us today. We hope we see you next Thursday for our next Medicare webinar with Jim, Leslie, and Rogers, and on December 6th for our Christmas celebration. So we'll look forward to seeing you next week, and bye for now. Thank you all.
Bye, everybody. Nice
Bye now.
talking to you all.